Welcome everyone. Thank you for joining us today. My name is Ariba Yunus. I am the Senior Specialist of Global Partnerships at Sun Life. Very happy to be here today. At Sun Life, we see firsthand the effect of diabetes around the world on our clients and Canadians across Canada as well. And since 2012, we have committed over $31 million towards diabetes prevention, awareness, and treatment initiatives, including this partnership with University Health Network. Over 3 years ago, we announced to launch the Sun Life Diabetes College, and the goal of this project is to improve health and wellness of Canadians across Canada. And we do that through diabetes prevention and management programs offered on Diabetes College. If you haven't already done so, I would recommend that you go online and check out this useful online resource today. And I'm also pleased today to introduce to you one of our health experts from UHN, Dr. Paul O. He is the Medical Director, Cardiovascular Disease Prevention and Rehabilitation.
Thank you, Ariba, for the very kind introduction. We're very pleased to be able to bring you this second in the series of educational topics for the Sun Life team. We would like to echo the sentiments that this has been an absolutely fantastic partnership from our perspective, and we're very pleased that we can actually have these engagements for some sharing. We were joking before the session, we wish it was live with all of you in person as opposed to online, but we recognize that this is a great way for us to reach more broadly, geographically, and also temporarily, that some of you we recognize won't be able to watch this live, but we do hope that it will be convenient for you at the time that suits you best. The session today is about the importance of self-management. Now, we brought you a very in-depth topic last time around nutritional approaches for the prevention and management of diabetes. On this occasion, we're actually going to go broad in terms of all of the different aspects of diabetes self-care. Through this session, if you come up with any questions, please feel free to email them throughout at the email address shown, trf@uhn.ca. We'll compile them and do our best to answer them at the question and answer period of this session. If there's an overwhelming response with questions, then we'll certainly follow up via email or other types of responses so that we can get your specific question addressed. So the outline for this session in particular, it seems a little bit dry, a little bit broad, but what I hope by the end of this session that you'll walk away with is a real appreciation for how complex living with diabetes really is. That there's many decisions that need to be made every day, and to be a really great, successful self-manager, then here's a few elements that really go into this. Lots of knowledge about your own disease, about the complications, medications, how to monitor, how do devices and technology fit into this, how our social supports might help us in better management, how we might think about targets and the complications that might be associated with diabetes, the role of medications and lifestyle interventions like nutrition that we talked about last time, or exercise that we'll touch upon on this occasion, the central importance of emotional well-being as well. And all of this hopefully will lead back to that call to action that Ariva started off with, that there are some great resources located within the Sun Life suite of offerings at the Sun Life websites, as well as our partnered website at Diabetes College. So ambitious, yes, we'll cover off a lot of material. Hopefully you'll take something away from this, I hope. All of us know somebody living with diabetes, that we would wager, given that the prevalence of diabetes and pre-diabetes today in Canada is about 1 out of 3 Canadians. And in my immediate family, there's 3 individuals who I will have Christmas dinner with, for instance, who have diabetes. And in our programs, we have had the occasion to work with tens of thousands of people who are living with diabetes. We can see that there's many decisions that come into play on a daily basis. And stylized in this collage of just understanding what your condition might be. If I'm going to embark on exercise, what should it be? Should I lift weights? Should I do walking? Should I swim? Should I do cardio of other types? Do I do high intensity interval training? Maybe some of it's good. Maybe some of it's actually bad for my sugar control. I need to figure that out. Do I need to poke my finger? Or just before this session, we were talking about the idea, what if I had a continuous glucose monitor? Is that the thing that I really need to best manage my sugar control? Other related medical issues like blood pressure or cholesterol, how does that impact on this? We tried to demystify diets last time, and I think our conclusion there was there's no single diet that works the best, but being mindful of what you're doing and having more plants, that's a good start. And then the bottom right talks to that pyramid of drug decisions that need to be made on an ongoing basis. So the next kind of 40 minutes will touch on each of these elements to give us a flavor for complexity that then we can turn into something positive, that we can become champions of self-management, and why a company like Sun Life is so heavily vested in this area, and the activities that the company can bring together for personal, for family, corporate, clients, that there are many things that we can do collectively to help improve this experience for the millions of Canadians who are affected by diabetes. Now, it's been proposed that living with diabetes is complex, and the level of decision making that has to happen on a daily basis is likened to decisions of flying a jumbo jet without the autopilot. So how fast, how far, altimeter, wind, precipitation, who's in the back, who's in the front, do I have enough fuel, where am I going anyways, have I gotten there yet, how much other traffic is going on, there's a bird, there's a plane, it's Superman, it's all of these things might come into play. 500 decisions through the course of your day devoted to managing diabetes. It is indeed very, very complex. And if we think, oh wow, our healthcare system is going to manage it, isn't it? So if this is a year-long calendar and each check mark denotes the visit with the expert in diabetes. Now, this is the nominal expert that we describe in healthcare. This person could be a nurse practitioner, a dietitian, a pharmacist, even a physician. But the point that we're trying to make here is that maybe you'll see somebody, if you're lucky, every 3 months for your medical visits. The recognition, of course, is that the person who has to live with their diabetes is entirely outside of these medical visits. At best, you'll get 4 hours with a healthcare practitioner. 8,756 other hours are spent with yourself. So who really needs to be the expert in this equation? And I think the answer is obvious, that self-management is the key to diabetes care, not the healthcare practitioner. Who really needs to be in charge is the person, the client, the patient, and the people around them in a close circle. And I think the role for people like us in healthcare is to be the best supporters, to be the best coaches that we can be. We can interact at critical moments and provide that expert input, but the self is the person who really needs to take care of this. Self-management, of course, is a big deal in diabetes care, and our diabetes educator colleagues, mostly nurses, but pharmacists and dietitians and kinesiologists, and occasionally physicians as well, will have that professional title of diabetes educator. And there's been lots written about this and manuals created, and you'll see kind of from this cartoon that the elements of good self-care are those domains that we've articulated around healthy eating and being active and monitoring and taking those medications. And self-management is then defined by an individual's ability to manage all of these elements together in a successful way. But it's more than just symptoms or drugs, but it's the physical, it's the psychosocial, lifestyle, all of these things. If we can do it well, then our conditions will be well managed. If we don't do it well, then things will spiral out of control. If any of you caught our session last week that was broadcast as part of our sessions from the Blakely Wellness, Health Innovation Wellness series, then we talked about the importance of change, and doing change well or change for good. And part of those core elements are kind of knowing where you are right now and where you want to go, setting small goals every day, every week, and achieving those small successes, building towards the longer goal. And that's clearly a key element of successful self-management. Other parts of this, and we'll go through that kind of collage in serial fashion, but just to give us a flavor, this is by no means exhaustive, but it gives us a flavor again for complexity. So it might start simply with understanding what your condition might be. And it surprises me, but maybe it doesn't surprise me, that every day I meet somebody living with diabetes that has an aspect of understanding of their condition, but perhaps not as complete as we might desire, either one of us. Understanding that diabetes is in fact a head-to-toe type of condition. We focus perhaps on the central role of the pancreas and the inner organs in regulating blood sugar control. The pancreas's role, shown there kind of like a corn of cob, with these little cells in the middle that are called islet cells that produce insulin. That's an important function that insulin circulates around in response to glucose loads that come from meals or through some other mechanism. And that's the way that we maintain balance or homeostasis. There's lots of things that can go wrong with this equation. Too much intake, insulin not coming out of that pancreas, or insulin not being able to respond with our peripheral tissues. And understanding where those defects might lie is important for that individual in front of us. A young person living with type 1 diabetes, for instance, the major problem might be the pancreas is dysfunctional and there is no insulin being produced. An older person who has adult onset or type 2 diabetes, the issue might be the pancreas is actually quite functional, thank you very much, producing lots of insulin, but it's just not affecting the tissues in the way that we might like and not being able to open the channels to utilize the sugar properly. It's a very different approach for both of them, but there might also be a foundation of many elements that might be the same in self-management. So understanding which condition we're living with is actually very, very important in terms of moving forward. Thoughts from self-management around taking action. Again, hitting these high points of successful self-management means that you'll probably take your medicines and you'll eat healthy and you'll exercise and be active and manage stress and depression, and you'll check your blood sugar at the right intervals. You'll avoid other risk behaviors like smoking or breathing secondhand smoke, and we'll return to more of these elements moving along. But if this was one thing that you might put on a card and carry it around with you and share, then this is the action card that we might take. On the notion of monitoring, well, it's not just checking a sugar, but then the questions we might be asking is how? What's the source of this sugar? When should I check it? And what does it actually mean? So sometimes we'll just check a sugar randomly, but there's never truly a random blood sugar, that it's always in relation to when we've woken up, when we've had our last meal, when we've taken our last medication, for instance. And knowing the relationship from that sugar interval or from that point of testing sugar from those preceding events will tell us what the responses of our own body are to the things that we've ingested, taken in, to understand what those patterns might be. So random sugars, that is sugars at other times of the day, throughout the day, are extremely instructive to us, as is the fasting sugar, the one that's taken first thing in the morning before you've had your breakfast or your first meal of the day if you're on some unusual kind of schedule. And that tells us about the overnight control, and for instance, some people will use it for adjusting their evening insulin doses to know what happens the next morning. Hemoglobin A1C, we're going to go into that a little bit more detail, but it's a longer term measure. And then occasionally in the workup or diagnosis, we may actually give you a big sugar load, like 75 grams of sugar in solution. So it's taking like an extra large can of soda and drinking that down and then measuring what happens to your sugar levels for the next couple of hours. And as you would predict, if the sugar levels are very high, then that can be indicative that there is a major problem and you may in fact have diabetes at that time. So lots of things that we need to do in terms of sugar measurement. For the actual measures of sugar at other times that one can do on one's own, then these devices exist, and I'm sure you've seen many of these glucometers or glucose meters. They come in different sizes and shapes, and the technology is improving all the time, which is really great. The design of the devices allows for capture of the data, smart input into an application on your smartphone or onto a web portal that can be shared with your physician, so you can really understand what the longer term pattern of sugar control would be. But then it's not just enough to get a device, because we actually see people that have been living with diabetes for many years who have a device that might still be in the box, or that might be really, really out of date. The key is to understand how you use this to your advantage. So when should you take your sugar in relation to assessing your response to food or drink, or your medications, or your exercise activities, or your feelings of stress or anxiety or depression, or if you're feeling unwell, if you've contracted the flu this winter, then that would be a good time to do some extra monitoring to ensure that your sugars are not spiraling out of control, for instance. Or if you're feeling like you have a high sugar, you're very thirsty, you're tired, you're urinating frequently, or if you're feeling very low, you're tremulous, you're shaky, you're getting a little bit confused, then these would be great ways of checking, is it your sugar that's actually doing this for you? So monitoring with purpose according to how you're feeling or the things in your life that occur on a daily basis is really important. Are you getting the sense that this is like flying the airplane? That all those gadgets and gizmos on the dashboard actually play some role? And this is one of those windows into that. We mentioned this thing called hemoglobin A1C that refers to the amount of sugar. In the cartoon on the right side, it's kind of showing that the little blue dots represent a stylized version of glucose or sugar that's floating around and attaches to those red cells. So remember, in the red cells in our body, we've got this molecule called hemoglobin that oxygen attached to and carries around in the body. Well, it's interesting that that's also a convenient place for sugar to attach to. And when sugar attaches to it, it hangs around for a long time. That is for the duration of the red cell, which is about 100 days or 3 months. So if we actually sample this measure, it gives us an idea of how much sugar has been floating in through somebody's body over a long period of time. That is 3 months. And this is then a more stable indicator of what one's sugar control would be over that long period of time. It is expressed as a percentage in the table on the left-hand part of this graph. It shows that the numbers range from 5, which is perfectly normal, up to 12, which is terrible for diabetes control. And then there's a corresponding average sugar level. So if we were actually poking your finger over and over again to measure a sugar level, you can see that the range there goes from 5.6 of an average blood sugar level expressed as millimoles per liter up to almost 20 at the upper end. So that's the relationship, and that's how we might interpret it. And for a lot of the diabetes care from the medical decision making, we'll look at those A1Cs and try to target 7 or less to say our control is pretty good. Higher than that, we say there are some opportunities to tweak medicines, food, activity to try to make this a little bit better. The lower the A1C number is, the lower the risk of developing complications. Those are coming up. So then we can set in that dashboard world of the cockpit that's flying around, or the diabetes that might be there on a daily basis. Here's another way of expressing some targets. Because we need to know the target in order to set our daily goals to achieve some of these things in a successful way. So we've just learned about A1C, which represents a long-term average glucose level. That can be conveniently labeled the A of a target. B would stand for blood pressure, and C for cholesterol, D for depression, E for exercise and improving fitness and activity. F, well, that doesn't stand for stress, but that's just where it fits. And G is for smoking, as one example. And others would say, know your A, B, C, D, E's of diabetes care. And that's one other way of expressing a recipe for self-management. And speaking of complications, this is it. Again, we're giving you a bit of a broad potpourri of diabetes care, but again, these are things that might be on people's minds. And sometimes we as healthcare practitioners try to impress this on our patients to say, you better behave with your diabetes management, you better get your sugars down, or else all of these things are going to happen. I don't know how well that message is received, frankly, and sometimes it goes the wrong way, but it does behoove us in this kind of targeted world to think there are some things that we can think about on the horizon, think about it positively, that this is the trajectory that I could avoid this pathway, as opposed to being punitive. You will run into problems like eyes or other things that will happen. But just here's an idea that, as we said, diabetes is a head-to-toe kind of condition, is not just a sugar problem. And in our brain, that diabetes will accelerate, for instance, the development of vascular problems in the brain, may even upset some of our cognitive processes and make it more difficult to concentrate and think and remember things. In our eyes, that having high sugar loads as well as other aspects that come along with diabetes can affect the vessels or other kinds of leaking materials in the back of our eyes and affect our vision. Poor dental hygiene might be, or dental health may be part of this. The heart, where I live, we see lots of people, unfortunately, living with both diabetes and heart disease. And there are the usual kinds of blockages in coronary arteries that may come up, but there's also some unique things that happen with people with diabetes, where the heart muscle actually becomes stiffer over time, a so-called cardiomyopathy related to diabetes. And that can be quite challenging with poor energy and breathlessness, and just difficulty getting through one's day. So being mindful of that as an issue. The kidneys are the filter for all of the blood flow in our body, and liters and liters and liters go through the kidneys all the time. So you can imagine it's a high pressure, high flow filtering system. If we dump a lot of extra sugar in there, this filter gets damaged in various ways, and the filters start to get leaky. We can lose protein, we can lose kidney function over time. And I think, as many people are aware, that diabetes is one of the most common reasons for developing poor renal function over time, and in fact needing dialysis or transplantation. So good diabetes health is also meaning that it's good head-to-toe kind of health. And then thinking about what happens in the periphery, well, nerves may be one target, where the small nerves in our fingers or in our toes are particularly sensitive to high sugar loads as well as other protein deposition, and those nerves can be damaged. Initially, it just might be felt as a little numbness or tingling, but later on, complete loss of sensation may lead us to damage our extremities and not even be aware that we've got some major gashes, wounds, big ulcers, and this is what leads to things like amputations when you couple that with vascular problems that can affect our periphery. Whew, that's a lot of stuff. And that's like the mountains on the horizon as we're flying the airplane or trying to avoid crashing into the ocean, as an analogy. So we say, well, you got high sugar. Well, let's do something about it from the medication perspective. And, it's interesting. We're in our 99th year here in Toronto, here at the center where Banting and Best kind of developed the whole ideas and discovered insulin. So it used to be we only had insulin as the option. And for a few decades, that was the case until we started bringing in oral medications. Now there's actually a whole bunch of oral medications, pills, that can be introduced. That's actually very, very exciting. But it makes the decision-making rather challenging. And while pills and injections have really good effects on lowering sugar and reducing complications down the road, they also have their own challenges. And for instance, if we would say that, the way we need to think, or the way we think about the development of diabetes is, we've not been eating well, we've been putting on weight, the cells in our body are kind of getting stretched and resistant to insulin. So let me give you a therapy that's going to jack up the insulin in your body and actually make you put on more weight. That's an odd thought. It's going to actually maybe compound this problem even further. So we need to be mindful that there are some treatments that can almost seem to turn the situation like backwards in a way. There are other medicines, while we want to lower sugar, can actually overshoot and make sugar go too low, and that can also be dangerous. So we're starting to think these days about really personalizing care and thinking about the medicines that might actually do the best for us. And the Diabetes Canada and the really smart people that have developed guidelines start to develop algorithms like this, which is great in terms of clinical decision making. But I would imagine, as somebody coming to the table living with diabetes, you look at a flow diagram like this and you think, oh my God, where do I fit and how do I make any sense of this stuff? And then we're calling out certain questions like, if you had heart disease, then there's really specific kinds of therapies that one might call out. In this case, I'm showing you a slide from one of the big studies done with a particular compound called empagliflozin that says if you're living with cardiovascular risk factors or cardiovascular disease, that the choice of therapy actually makes a difference in terms of future heart problems. In this case, over the course of 4 years, it lowered it by about 14%. So decision making becomes a little bit more complex. We need to think about these things, like how high is your sugar? If it's really, really high, then I might need to give you 2 or 3 things off the bat, or I might just start you off on some injections to really push the sugar down quickly. If you are at real risk for low blood sugars, if you're in some job where, having even a minute lapse of control might be a big issue, then we really don't want you to lose control and have a risk of low blood sugar, so I'm not going to give you that. If we want to think about the weight control and encourage you not to lose or gain any more weight, then I might make a specific option. If your kidneys aren't working, you remember the kidneys are one of the issues that come up with long-term diabetes, well, that might actually prevent me from using certain kinds of therapies because it can actually be dangerous. Across this country, unfortunately, there's variation in our access to specific therapies. So what I might choose in British Columbia might be different than what I might choose on the east coast of Canada, which might be different in Ontario and Quebec, etc. So regional disparities are really, really important. And as sponsors of benefits and plans, then I know these issues are forefront in your mind as well, about thinking about equity and broad coverage and trying to bring as many benefits as we can to the Canadians whom we serve. And then certain patients may just prefer one therapy to the other because of convenience, timing, need to adjust meals and things like that, or friendliness with other kinds of activities. So lots of things that we need to do. And here's another table from the Diabetes Canada guidelines, a previous version, that says, wow, there are all these other things, and I need to think about side effects, and then I need to think about mechanisms, and I need to think about costs and what else is going on in terms of their therapy. So boy, my dashboard really, really got a whole lot more complex here, but this is where the healthcare practitioners can spend that time and help people come to the right sorts of options. That was the A, right? Okay, so we're on to the B of the blood pressure. I promise you won't be here until 6 o'clock tonight, but we will move through this. But just to give us some more thinking that, blood pressure, for instance, I think many of us are familiar with the idea that blood pressure is something that's in us. Systolic blood pressure is the upper number, diastolic is the lower number, and that the definition of high blood pressure is if you're above 140 or if you're above 90. Ergo, if you're below 140 and you're below 90, then, quote, that must be normal blood pressure. Not exactly, but that's the way that we might actually operate. For people living with diabetes, because folks are at such risk from their hearts and their brains and their kidneys, we actually have a lower target for these individuals. So you have to not only be good, but you have to be really, really good, not just with your sugar, but with other issues like blood pressure control, and there's specific drugs that might help you there. More drugs, my gosh. Cholesterol. Here's yet another really complex algorithm from really smart people that write guidelines to say, wow, how am I going to navigate through this? What kind of person are you? What kind of risk factors do you have? But the point here is that if you have diabetes, we already said that your risk for developing heart problems might be high. Therefore, we would like your cholesterol to be really low. Once again, not just good, but really, really good. And here we need your LDL cholesterol, the low density stuff, the lousy stuff, to be less than 2. I got a lot more things to think about. It's not just about sugar. I got to think sugar and blood pressure and cholesterol, and I got to think about my mental health. In fact, I don't have to think about my mental health because it's there all the time. And just to recall that living with a condition can be tough. Living through the day might be tough. And we know workplace stats, like 1 out of 2 of us is probably going to experience a major affective condition at some point in our careers. Think that people with living with conditions, that's probably even elevated further. And what we see is that people that enter our program, about 50% of people with heart disease or diabetes or after a stroke will endorse significant depressive symptoms. I feel down. I feel blue. Sometimes it's hard getting up in the day. My energy is not so good. My sleep is not so good. If this sounds familiar, then you're not alone. And indeed, people living with diabetes, they're not alone, but they may feel like they're alone. What we know is that this not only is a marker of a low mood, but it's also a marker for really other bad things happening, like increasing the risk of mortality by 30%. So having low mood is not just mood, but it affects the entire part of us. And it also affects our trajectory of living with a condition, as we might expect. If your mood is low, your motivation is low, your energy is low, it's hard to manage the rest of that dashboard. It's hard to think about food and medications and doctor's appointments and what is my blood pressure today anyways? Does anybody really care? We really care, but it's tough. So we can do some other things. Like getting active might actually be a positive way about thinking about mood and actually changing things. And this kind of study says it's also not so easy, but it is easy. It's simple, but not easy. How's that? This kind of study that was done by some colleagues in Edmonton, or Calgary, I should say, looked at the effects of exercise over a 6-month period of time on blood sugar control. The red bars on the left-hand axis is sugar control, A1C. You're all experts in that now. And then across the bottom are 4 different groups of exercise. The first group are called the control population, and you can see what happens to the A1C level over 6 months. Red is baseline, blue is 3 months, green is 6 months. And you can see for that group that sugar levels tend to go up over time. Unfortunately, the majority of Canadians living with diabetes fit that group, control. Or the best advice I can give you, I think you should move more. Good luck. I'll see you in 6 months. And I shouldn't be surprised then when the sugar levels are higher. The next 2 groups represent individual kinds of exercise. AT represents aerobic training or walking types of programs. And you can see from the walking programs, 30 minutes a day, 5 days a week, that we can lower sugar levels, in this case about 0.5% of A1C. That's pretty good. The next grouping is RT or resistance training, lift some weights 3 times per week, set of 10 exercises, circuit, upper body, lower body, core. You can lower sugar by about 0.5%. And the really exciting stuff happens when you combine walking with weight training. You can lower sugar about 10%. This is as good as any medication that I can offer you. The side effects here are your mood is better, your heart is better, your blood pressure is better, your cholesterol is better, you're just a little bit more sweaty, a little bit more smelly, but your diabetes is a whole lot better off. So think about that. But as we said, it's simple, but putting this into your day-to-day life may actually be a little bit more complex, but that's something to do. And if we embark on injections like this, this is meant to represent insulin injections that go into different parts of the body, such as in the belly, what we've already said is that insulin may actually cause people to gain weight. And on average, they'll gain about 1 kilogram over the next few months. If we actually get people exercising along with taking the injections, their body weights can actually go down and their sugar levels gets improved by about a factor of 2. I didn't say that very well. It's better to exercise. Your sugar's better, your weight is better, but just to think about that as an adjunct. But gosh, it's not just so easy just to exercise, because we got to think about, here's some bad things that might happen with just exercising if you're living with diabetes. Then we have to think about what your sugar levels are. And exercise is a great way of lowering blood sugar, but for some people, if you're on certain kinds of medications that make you prone to low sugars, it can go even further. We have to make sure we think about carb intake before you exercise so that you're even throughout. Make sure you're adequately hydrated. Think about when you took your medications. Check your feet, because we said the nerves will go, the blood supply may go to your feet. We don't want to pound on the calluses too much on the balls of your feet and cause a breakdown of the skin, for instance. So having good shoes and good socks is really, really important. Avoiding muscle injuries, because lots of us have aches and pains. So doing a warm-up and a stretch and then getting into your activity, making sure you do your cool down and a stretch is really important. And getting to the right level of intensity. Don't go running on the treadmill out of the gate. Start with the walk and build this up gradually, and then being really sensitive to weather considerations. So while it was simple in principle and easy to say go exercise a little bit more, we need to be thoughtful about this, and gosh, the dashboard just got a little bit more tricky. We had an extensive discussion a couple weeks ago about nutrition. If you haven't seen it, then go view the webinar about nutrition and diabetes and kind of current dietary approaches. Here, I'm highlighting once again, there's this very complex table that comes from Diabetes Canada that says, here's all the different kinds of diets that one can follow. How am I going to make some sense out of this? And the idea is that if we reduce it to something like a food guide, a plate, that has lots of colorful vegetables on half of it, some healthy protein on one quarter, and then some high fiber grains in the other quarter, we're doing pretty well. But if we start with the colorful fruits and veggies, we're doing pretty well with this, and there are many variations on that. And here's a fun thing for self-management. Again, we alluded to this when we did the nutrition talk, that you can actually go score yourself. So if you go onto the Diabetes College website, there's a place there in the nutrition portfolio that talks about scoring your own self on the Mediterranean way of eating, which is an excellent way of preventing diabetes, managing diabetes, reducing your risk of heart attack and stroke. So it'll ask you questions about olive oil, fruit and vegetable consumption, not having butter and sugar, having healthy sources of protein, more fish, less red, less processed. If you get a good score, you're doing pretty well. Otherwise, find some opportunities to tweak this up. Learning how to read food labels is one other core skill that nobody taught us about, right? It's on every box, but nobody's actually talked to us about how to read these food labels. It would be a basic piece of health literacy. It's a core skill of self-management. And if you actually want to know how to read a food label, go to diabetescollege.ca. There's a 2-minute video about that, which I think is an important survival skill. We alluded to the notion of emotional well-being already. We've already said that depression is common in chronic disease, comes on. Well, we can call out stress and anxiety and poor sleep as other markers that are common in diabetes. The other specific syndrome that we can talk about that we see come up fairly commonly is this notion of burnout. Now, all of us may feel some degree of burnout just from our daily lives, certainly busy workplaces. Some of us will thrive on stress and be able to get through this, but others feel like, man, this is a lot. And it's okay to actually pause and call it out, because if you don't, then this just leads to further decline. But imagine if we offered you these kinds of statements, that diabetes-specific burnout is that you start to not care about caring. And you can let slide your sugars and your medicines and monitoring and anything else. If you feel alone or you feel like you're not getting any support, if you feel like you're the only one here who's dealing with diabetes, if you feel guilty, because actually that's a prevalent thing in society, whether we know it or not. Oh, that person developed diabetes. I bet they were lazy. I bet they didn't eat very well. No wonder they'll have it, And it's not and it really shouldn't be that way. But sometimes those are the messages that are put out there, and so that's the way that some people feel. If you're angry or upset that things aren't perfect, if you feel like giving up, if you feel like, oh gosh, this is really at odds, I'm going to go on a binge of some sort, that, it's not just the binging part, but it can actually have serious consequences on one's own body. If you stop listening to people and actually just giving up, then this clearly is when we're into burnout. So that's one part of it, is recognizing that you're there. Maybe the second part, so maybe if you're going to print out another card. They're the big action cards in general, but here's the other one, and maybe this is about diabetes, but it's also about everything else in life. How do we help deal with burnout? Well, let's call it out. Let's name it. I am feeling burned out. And actually in healthcare, as an aside, we are actually going through this as a medical community with our nurses, with our allied health teams, with our physicians. And burnout, stress is common in our workplace. It pervades all elements of society, and if you're living with chronic disease, it's there as well. Accept and name it. Take care of yourself. Do something every day that does not involve your diabetes. Now, we've already said, oh gosh, if I'm flying the jumbo jet, can I do something else for fun? And the answer would be, yeah, you probably need to, because you're flying the jumbo jet every day. And practice your self-compassion, that today is, whatever I can do today is going to be good enough because I'm a good person and I try really, really hard. Don't be so judgmental or critical of oneself. Diabetes is part of me. It's part of being human. Be present in the moment. All that, the important attention to mindfulness and meditation today, we need to bring that into our lives, our work, and for people who are living with conditions. And remember that you're not alone with this. If we come with the stat that 1 out of 3 people are living with diabetes, there's a very good chance that somebody in the room is also going through these same things, and supporting each other may be a great idea. And, as a corporate responsibility, again, it's such a great thing that Sun Life is so vested in bringing these resources to the country and probably the world in terms of drawing attention to these areas and making it better. Okay, I'm kind of wrapping up here. I'm just checking out my time here. I think we're good, and we'll carry on. That so this was again a collage, a snapshot of a lot of the complexity that's out there, and you would say, that's a lot of stuff. How am I supposed to make any sense? Is there any frame to this? And we always like to kind of package things together into something that's sensible. And that was really the opportunity that we saw in working together with the Sun Life team. That we are also aware from our work in helping people live with chronic disease that education with purpose, therapeutic education, and skill building and behavior change can all go together. So patient education can actually enhance self-management, and that's why we're so vested in this area of patient education. And you can see from this cartoon that many things will improve if we can educate, build skills, build confidence, and if we're thinking of healthcare system, that, so at the individual level, we can see things improve, like taking medications, eating better, exercising. We can see symptoms improve, like less fatigue, less depression, behaviors change, like less smoking. But then we can also see in our interactions that we can have better conversations. And part of our goal-setting action planning, a specific one, is just how do I prepare for a medical visit? If I'm only seeing somebody for 4 hours out of 9,000 out of the year, how can I make the most out of those 4 hours? Or sometimes it's even less than that. Maybe it's only 15 minutes times 4, so that's 1 hour. How do I maximize that interaction by being prepared with all of these things? And then we know as a system, if we can do all of this better, we're looking for solutions on how to bend the curve on the tsunami of chronic disease and aging and all kinds of other things. That if we are all better empowered, that we can actually have a better, more functional, efficient, lower cost healthcare system. So that brings us to the college kind of concept. Ariba, you challenged everybody, and hopefully everyone's had a chance to log on. But no, maybe they haven't because they've been so fixed on this marvelous session. But you will, right after this, you'll run and go have a look, and you'll see that this was actually built with the purpose in mind of all the stuff that we've talked about. That if you're looking for a good, trusted, credible source of information, which is what we're all doing, and certainly our patients, clients, families are doing, then this is it. That this is one place that our teams and our patients have worked together. You've got the college there, and you can see that there are these 5 pillars of really good self-management. Understand your condition, get active, eat healthy, feel well, ultimately take control of your health. And this is what self-management is about. So treating diabetes, you'll see there's a pillar, a whole set of information there that's understanding more about your condition. And as we talked about it, what is diabetes? What's type 1? What's type 2? What's gestational? What do all these medications mean? How do I do monitoring? How do I actually get active on a safe basis? What is aerobic? What is resistance? What is exercise safety? What if it's hot? What if it's cold? What do I need to do? We even show you how to exercise, because some people have never done these things before. And it's the most fascinating, remarkable, exciting thing when we work with our 80-year-old women, for instance, and teach them about the merits of lifting dumbbells. And when they get it, I still remember this conversation of somebody telling me, we had a lovely conversation, and she said, "Please excuse me, doc, I need to go shred some iron." I thought, this is fabulous that we've had that transference of behavior. Eating well, eating healthy. Again, lots of resources there. We talked a bit about it in our last webinar. Lots of resources here about nutrition profiles, healthy diets, videos, recipes, tip cards for the store. Feeling well about our emotional health and sleeping well. And then ultimately the other steps on taking control, and you'll see a section there specifically called Become a Self-Manager. Our psychologist in our program says, become the CEO of your own corporation. It's called Health Incorporated for you, and that's really what you need. Okay, so we've gone through a long journey. It feels like it, at least for me, but hopefully it was informative for you, and we've taken away at least a couple of things. Quick recap. Self-management in diabetes, sugar control is important, but it's a lot more than just sugar. And all of us will play some role in this to help support, coach the person living with diabetes. Our roles as healthcare practitioners need to evolve from that expert to also the supporter and the coach. The patients themselves will be their own best experts in this. we can help support. If we're embarking on education, we're very grateful for this privilege of being able to build a platform together that provides education with purpose along these pillars of disease awareness, exercise, nutrition, psychosocial health, and ultimately taking control. And hopefully through this, we can create a society, because it's a whole of society solution, where we can activate everybody to be their own self-managers. Positive change is possible. Healthier Canada is possible. People living with diabetes need to be the experts in living with their own condition, and that's the place that we need to get to. Okay, so that's the end of this didactic part. We're excited to move into a question period. Reminder that if you've got a burning question, comment, then please fire off an email to trf@uhn.ca. Our monitors are live on the phone right now, ready to take your calls. Okay, here we go. Number one. The first question is about genetics. If my parents have diabetes, does that make it more likely that I will have diabetes? So one short answer is maybe, which is always a good kind of middle of the road sort of answer. So under what circumstances might this play out? So for people living with adult onset or type 2 diabetes, that there is some inheritance pattern to this, and we do see it run in some families. There's no single gene that codes for diabetes, because diabetes is expressed in many ways. If we think of the body figure and where the pancreas lives and muscles live and sugar and insulin interact, that there's many issues that need to go into play. But on a larger gene scale, I'm not doing this justice for the science people that are around me, but there is some transference across generations. And it's not surprising that for some people, when we've seen their parents develop diabetes, type 2 diabetes in their 50s, then there's certainly a risk that might be passed on to offspring. There might be a cluster together with diabetes, type 2 diabetes, and higher cholesterol values or triglycerides, and high blood pressure and heart disease. So they might lump together. Again, not single gene, but clustering. So that's maybe the downside of genetics. The upside of genetics is that because there isn't one single strong gene that's pushing this, is that we can modify what happens in a big way. So starting at a younger age to think about what we eat and how much we move through the course of the day, and being very mindful of being healthy on a daily basis can really change our trajectory of whether we've developed diabetes or not. Number two, is it important to record what I eat in addition to glucose levels? And I think that's such a great question, that we know that there is this striking relationship between food input and what happens to sugar levels. And one of those initial exercises that people should go through when they're recognizing that they are living with diabetes is to look for that relationship. So what is it about this meal that might make my sugar go up or stay stable? Often people will learn how to look at their carb component in particular, and if there's a lot of simple free sugars that are there that can spike our sugars upward and our bodies don't deal with it, then that's an important realization versus balancing out that meal so that sugar levels don't go up as much. Are there plans to provide diabetes college into more bite-sized or app-sized information? And could we integrate that into other platforms like Lumino? So on the second part of that, we know that Sun Life has had a remarkable adventure in launching their digital health platform, Lumino. And we've had a number of great conversations with Anne-Margaret Neiman and others over this last year and a half or so. We're delighted to say that we've had some collaboration already. I learned a new phrase, which I find fascinating, and I try to bring it up whenever I can. We're going to surface this information within the channel. And I thought that was a submarine reference, but it actually is about surfacing digital health information in different ways and then sharing it as widely as possible. So that's great. And there are articles or there are links to specific aspects of Diabetes College. But we recognize that people think differently and interact differently with information. And one of our goals over time will be to transfer some of the great resources that might live in a book or on a website or in a long video into something that might be more compartmentalized. And hopefully one day in the not too distant future, there'll be an app in your hand that will have lots of short bits of motivational information, lots of tidbits of your fact of the day, and coupled with some monitoring purposefully that will help us with diabetes management. Great question coming up of how does shift work impact diabetes? I have an unpredictable eating schedule. How can I manage my diabetes better when I'm not sure when I can eat? Wow, this is certainly a big challenge. And we know that people who work shifts have a number of challenges: disordered sleep, disordered food, higher risk of all kinds of issues, including heart disease. So trying to stick to as much of a this is not a good answer, but I'm going to try. Trying to stick as to much of a routine as possible is certainly helpful, but that I recognize that's in the confines of a really disordered world. I spent many years of my life, as you might imagine, in this kind of netherworld where you worked either overnights or you just worked long, 24, 36-hour shifts, and you ate when you can and you moved when you can. And then if you threw medicines into that's clearly a challenge. I would say if the shifts are really disordered and you know that food intakes is going to be irregular and your sugar patterns might be irregular, apart from trying to find a routine from the chaos, then this might be a good opportunity for us to do a little bit more monitoring so we can understand what the impact of less sleep or taking an odd meal at the strange time of day might be on our sugars, and that might allow us to adjust our medications in a smart way. If it becomes really tough, if you're on insulin and you need to take an injection at a certain time, then we might rethink what the timing, type of medication that might be. Might there be some other options that have some more latitude? And some medicine, what I mean by this is some medicines work more gradually. We're even starting to see medicines that can work over once a week. So they've got very smooth action over a long period of time. And that might be more conducive if your physiology matches the mechanism for that medication. It might allow that forgiveness to accommodate a more variable work schedule. My mother has dementia and has diabetes. What can I do to help my mom? And I don't know if it's young onset or early onset dementia or later onset dementia, but there's some interesting things that came up along the lines of how do our brains connect to diabetes. And some have said that in a broadened classification of diabetes, it's thought that cognitive impairment or dementia is a form of diabetes, and that it shares some of the kind of the pathologic features of damage to parts of the body, scarring, degeneration. So that kind of has parts in common. We know that sugar fluctuations, whether it's too high or too low, can affect what's going on with our brains, and not in a good way, upset of mood and memory and executive function. So what can we do to help the situation? So once again, we're kind of into all of those self-management principles. If we can get to smoother control, that's probably a good idea. Not too high, not too low, just right. So we're in the dashboard of the cockpit, or we're into a Goldilocks fairy tale. Let's try to find that middle ground. The lifestyle interventions can help. We know that exercise is good for sugar control. It's good for the brain as well. It can actually improve mood and memory and executive function. And one of the discussions we got into last time as well around nutrition is that food choices can also impact glucose control and brain function. So have those plants, fruits, veggies, fiber, nuts, seeds, healthy fats. That's good for brain function as well. In addition to Diabetes College, are there any apps that I might recommend to help maintain or manage my diabetes? That's an interesting question, and I'll be very selective because we know, and this is actually an interesting question in that we know that there are thousands of apps that are out there, right, for healthcare, and there are some actually very good ones that are in the diabetes space that might be patterned after, for instance, the diabetes prevention program. A good evidence-based kind of suite of offerings around all the healthy lifestyle stuff that we talked about, with a lot of coaching that might be embedded in there that helps people on their journey towards being healthy. So that might be one evidence-based suite. No particular app there, but the concept might be there. There are commercial companies around the world that offer particular applications that have some proof of benefit. It's important to disentangle what might be the app itself versus what might be human health coaching alongside of that, and then being aware what the package might look like. On a local environment, of course, I would be remiss if I did not give a shout out to my colleagues in the Global eHealth Innovation shop at Toronto General, Dr. Cafazo and Dr. Goyal and others who have developed the BANT applications. And I know Sun Life has had a collaboration with this group as well, and that's a tremendous resource for young people living with type 1 as well as older people living with type 2 as a friendly way of tracking, monitoring, intervening, and we're having good discussions with the group on how to integrate more of our educational materials into that application. So I would say that there's some good examples, there's more space, and then the final thought would be around applications, of course, is that just being thoughtful about what you're picking up, and the recognition that it's a small minority of applications that have had some sort of validation with a clinical study, with proof of benefit, either in a change in knowledge, a change in behavior, a change in outcome. And we'd like to really kind of pick up those apps or digital interventions that have some of that kind of benefit associated with them. Okay, would I recommend monitoring glucose continuously? So a continuous glucose monitor might be a little device with a probe that sits under the skin. You know, many of the current ones might sit under the skin of the belly. There's newer devices where you monitor quasi-continuously that might go under the arm, and they've got different brand names that you may be familiar with. The advantage of these sorts of devices is that you're getting a good sugar readout all the time, and that's to emulate what's going on in our bodies normally. So the pancreas has sensors that are looking for sugar all the time and responding to the fluctuations by titrating how much insulin or glucagon or other hormones that need to come out in the system. I'm pointing around my belly, my upper belly, where all this action kind of happens. So for some people, it's critical to have that minute-by-minute control. And I'm thinking mostly of people who might be living with type 1 diabetes that might be prone to rapid fluctuations in sugar that go up and down in response to meals, in response to activity, in response to medications that may be less predictable. Some of these folks may not only have continuous glucose monitors, but they also may have continuous insulin pumps. So the two of those things go together very, very well, because you can monitor sugar, adjust the flow rate of insulin together, and that makes good sense to adjust the physiology. So that's a place where continuous glucose monitoring makes good sense. At the other end of the spectrum might be people who take 1 or 2 pills per day. And for those individuals, while overall sugar control is very important, minute-by-minute knowledge of what that sugar level might be may not be as critical, because we're not doing those sort of adjustments in any kind of treatment or food or activity. And in that case, looking at that long-term measurement called hemoglobin A1C that everybody knows about, remember the blood cell with the blue dots on it? Just knowing that one from a 3-month perspective might be enough to allow us to do small adjustments in oral medications at those long intervals. So continuous glucose monitoring for some, not for all. And is there an on-site diabetes program that we could attend, and how do we sign up? So if folks in the audience or who are watching afterwards are interested in more diabetes care, if you're living with diabetes or a family member is living with diabetes, hopefully you're accessing all the resources that you need, from primary care providers to diabetes clinics, education programs and education centers that are hopefully well distributed across this country. And there's thousands of individuals that are really talented and knowledgeable that can help you out. If I extend the question a little bit to, are there examples of other programs that can work on all the lifestyle sorts of things? Unfortunately, there's there are fewer of those kinds of programs that exist. The optimist in me says, well, there's lots of opportunity for us to do this, and it might happen differently depending on the community that we're living in. It happens to be that if you're in Toronto, you'd be absolutely welcome to give us a call, come on by, visit. We happen to run a 6-month structured program for people living with diabetes where we will do individual assessment, exercise prescription, lots of education in a structured way over a 6-month period of time, where we can work on all those lifestyle interventions together. So it'll be a live face-to-face kind of coaching environment where hopefully we can achieve some good health outcomes. And indeed, our evaluation does show positive changes in mood and memory and sugar control and risk factors and exercise and fitness, and all of those really good. Finally, let's end off on a question about why shoes are so important. So we alluded to that in the description around exercise safety, and we also alluded to it in our conversation around complications, that our feet undergo incredible pain and impact on a daily basis. So they are the pressure points that have to withstand thousands of pounds of pressure on a daily basis. They take a beating. And we've already said that the feet of people living with diabetes may be compromised, either because of nerve problems or blood vessel circulation problems. So injury is possible, and skin breakdown and development of sores, ulcers is quite possible. So we need to pay attention to our feet very, very carefully. A couple of the survival skills is one, make sure you look at your feet, wash them daily with warm, not hot water, keep them clean, keep their toenails trimmed, watch for fungal infections, things like that, check the circulation, be very mindful if there's cuts or bruises that develop on the feet. And one thing you can do with your doc, how do you prepare for your physician appointment? Well, one thing you can do when you go in the room is take your shoes and socks off and make them look at it. So your feet are critically important, and your shoes are going to help keep them healthy. That's a fun place to end up on. But thank you very much for sitting in on this one. This was a long but hopefully informative session on why self-management is important, that there's lots of aspects of diabetes care. We could dive deeper into any one of these topics, and if you want to have that exploration, then do send a note to the team at Sun Life and Global Partnerships, Ariba or Marin, and I'm sure that they would be willing to have the conversation with us about bringing you more of these kinds of educational opportunities. We'd be thrilled to do so. Visit the college website for more information. Visit the resources at sunlife.ca/diabetes, and you're going to find a whole lot more information there as well. Thanks for your time. Signing off now. Thank you very much for your participation.